All right. Well, welcome everyone. Thank you for coming to the Medical Minute for this week. Bienvenidos a todos para venir a esta presentación hoy. My name is Ronald Castillo. I'm a third-year medical student. I work with Dr. Gorlitsky, and I've also done a lot of, exercise teaching at the Wellness Center at USC. Soy estudiante de mi tercer año, trabajando con la doctora Gorlitsky. So just a heads up, this presentation is a bit different from the other presentations. I'm going to be talking about exercise, and we all know why it's good for you. Well, we all know exercise is good for you, but we don't really stop to think like, why is exercise good for you? So I just want to bring up why why is exercise recommended, what are the recommendations, and what are a few things we can do at home during this very strange pandemic time. Y esta presentación hoy es un poquito diferente de las otras presentaciones que hago yo. Hoy vamos a estar hablando sobre el ejercicio. Todos sabemos que el ejercicio está bueno para nosotros, pero a veces no pensamos por qué está tan bueno el ejercicio para nosotros. Y voy a estar explicando diferentes estudios que enseñan los beneficios del ejercicio, las recomendaciones de cuánto ejercicio tenemos que hacer al día o a la semana. Y también voy a hablar sobre algunos tipos de ejercicios que podemos hacer en casa durante este tiempo bien raro. So we want to think, why do we want to exercise? And if you look through the literature, there's tons and tons of studies that are going to tell you that it's good for your cardiovascular health. There's even more studies coming out now that really talks about the benefits of exercise in relationship to mental health. And then if you do like a literature search, you'll continue to see that there's all these benefits. Back in the day, there was all this contention where like, well, there's no really randomized controlled trials, like maybe there isn't, enough evidence, but really through everything that we've seen, and the more that you look at all these, national guidelines, they all recommend some type of, physical activity. Y si uno se pone a ver todos los artículos que hay sobre el ejercicio, va a ver que hay muchas personas que tienen recomendaciones sobre el ejercicio, no solo para la salud del corazón o del cuerpo, pero también la salud mental. Y por eso es muy importante platicar sobre este tema hoy. But one thing that we want to stop and think as well is, exercise is recommended for sure, but we want to stop and think, how much and what exercises should we be doing? Pues no solo es importante hablar de que tenemos que hacer más ejercicio, pero también tenemos que hablar sobre cuánto ejercicio tenemos que hacer en la semana y también qué tipos de ejercicios queremos hacer, qué tipos de ejercicios son buenos para la salud. So this is actually one of the national guidelines, and a lot of like physicians and physical therapists, this is the thing that we stop to think about. And this is basically the minimum recommended amount of physical activity you should get in a week. This is the minimum. So the recommendation is at least 150 minutes of aerobic activity a week, or at least like 2.5 hours. And at least 2 days out of the week, you want to make sure that you're doing some kind of muscle strengthening activity. And then later on, I'm going to talk about like how many of us are actually doing this. And there's actually some good data on that too. Pues entonces, la recomendación ahorita es que queremos tener por lo menos 150 minutos de ejercicio aeróbico y por lo menos 2 veces al día hacer un tipo de ejercicio que va a ayudar con nuestra fuerza con los músculos. Y eso es la recomendación de la cantidad mínima que podemos hacer sobre el ejercicio. And there's, like I mentioned, there's many studies talking about the short-term and, long-term health benefits. And there's actually even more benefits than we previously thought we had. There's benefits with cognition. You have decreased incidence in different types of cancer. You have help with injuries from falls, especially with our older adults. There's been studies showing how it helps with postpartum depression, and really for any group, if we can eliminate excessive weight gain, that's going to help with all these other factors. Lo que estamos notando con los estudios que han salido es que hay muchos más beneficios del ejercicio que no pensábamos que teníamos anterior, puede ayudar con nuestra mente, puede reducir la ocurrencia de tipos de cáncer, um, puedo, puede ayudar con la depresión y otras cosas, pero la importancia es que hay muchos beneficios sobre el ejercicio que estamos reconociendo y por eso es muy importante seguir tratando de hacer más ejercicio. And these are just some of the benefits summarized about what I was talking about. Um, y esto solo está enseñando algunos de los beneficios que ya hablé. But if we stop to look to see who's doing like this minimum, the guidelines of 2.5 hours per week, you know, it's pretty striking to see that maybe about a quarter of people in the U.S. Don't have really any physical activity. It might be even more now in this pandemic time. Maybe about half of people meet the minimum requirement of the 150 minutes. In California, we're doing maybe a little bit better. It kind of varies, but it is important to note that these are the minimum guidelines set, but it's kind of hard to meet these goals. Lo que está enseñando aquí es cómo estamos haciendo sobre cuántas personas está haciendo lo mínimo cantidad de ejercicio que está recomendado. Y si miramos en los Estados Unidos, hay como 25% de personas que no hacen ningún tipo de ejercicio y solo mitad de las personas de los Estados Unidos están haciendo el mínimo recomendación de la cantidad de ejercicio. And if we, look at the map, they've also tried to look at it by state. You can see the dark green is, the bar's pretty low. The dark green is, how many people are greater than 25% are meeting that minimum recommendation. And there's no one who's doing it like 100%. California is between like 20-25%. Other states are way worse than we are. So we're doing something right. But it really goes to show that, the majority of people aren't really meeting that minimum recommendation of how much exercise we're recommending in a week. Y aquí solo estoy enseñando lo mismo que lo está enseñando por estado, cuántas personas están haciendo la mínima cantidad de ejercicio que está recomendado. Y como expliqué, en California está como a 20%, en otros estados está peor, pero solo esto está enseñando que es algo que no estamos haciendo suficiente aquí en los Estados Unidos. And if we think just of what exercises should we do, the guidelines really break it down to aerobic and strength. And, the way I've broken it down, or the way that, I like to think about it, is, you have endurance, which we call aerobic strength, and balance and flexibility. Often I feel like balance and flexibility is not really thought about as much, or it's kind of on the back burner. And a lot of the exercise classes that I've done with, my classmates, we teach a class at the Wellness Center. We have older adults, like 60 years and older, and really balance and flexibility is not really thought of as much. But if we're thinking about long-term and, preventing falls and preventing all these other risks, we really want to be thinking about balance and flexibility as well, on top of the aerobic and just regular strength training. Cuando pensamos de cuáles tipos de ejercicios deberíamos hacer, hay 4 tipos. En los estudios que enseñé, en las recomendaciones, ellos solo hablan de 2 tipos, de ejercicio aeróbico y ejercicio para la fuerza, pero también me gusta pensar en los tipos de ejercicio como el balance y la flexibilidad. Yo doy clases también para personas que han tenido diferentes enfermedades y personas mayores de edad, y muchas veces no pensamos en el balance y la flexibilidad. Y es algo muy importante que tenemos que estar pensando, porque teniendo fuerza y teniendo práctica con la balanza y la flexibilidad, podemos prevenir muchos problemas o caídas o otras cosas que los pueden afectar. And here is just a few things to consider. So whenever we think about exercise, we always want to avoid injury. We don't want to cause harm. And a few things that we just want to think about, a few things, always listen to your body. And I kind of tell everyone that I worked with, you know your body better than anyone. Sometimes you might start like a new program and it might be very intense and you might be feeling pain. You shouldn't be feeling that much pain, maybe a little bit discomfort, but if you're feeling like significant pain, you should stop. Sometimes it could be like mechanics of the exercise. Sometimes you need a modification. I think that's like a really important thing with any exercise program you're doing. Like always look, see if there's a modification. Make sure you warm up always, and always like start slow, especially if you're starting a new program. Um, Staying hydrated is really, really important. And if you're outdoors, which I don't think many of us are outdoors these days, but really pay attention to your surroundings. Um, Aquí estoy hablando que hay muchas cosas que tenemos que hacer para reducir los riesgos cuando estamos haciendo ejercicio. Es muy importante que uno este, escuche su cuerpo, porque usted conoce su cuerpo mejor que cualquier otra persona. Y si tiene mucho dolor cuando está haciendo ejercicio, o si se siente muy incómodo, mejor hay que parar, porque a veces es que el ejercicio está muy pesado o no lo está haciendo correcto, algún otro tipo de problema. Y es muy importante porque queremos prevenir que haya algún problema, no queremos que se lastime y es mejor llevarlo con calma, llevarlo despacito y después lo podemos hacer más y más y hacer unos ejercicios más difíciles, pero es muy importante tener cuidado cuando estamos empezando. And, we bring this up every time, if you have these are some red flags. You feel dizzy, if you have like any big severe cramps, severe pain in your joints or any like pressure, those are like real indications to stop, because we don't want anything bad to happen. Y también otras cosas que se tiene que estar de acuerdo, que si uno tiene mucha presión en el pecho o los brazos o se siente mareado o con escalofríos o tiene mucho dolor en las coyunturas, hay que parar el ejercicio. So these are just a few of, I guess, red flags, things to look out for. And then this next part I'm going to talk about, briefly, is just a few exercises to do at home. These are exercises that we would do at the Wellness Center. You'll see pictures of my classmates doing them. Like, they'll be demonstrating some of these exercises. A few things you can try at home. And the exercises that we would teach, we focused, our class was called Core Strength, and we really kind of focused on things that you can do at home with minimal or no equipment. These are things that, you can have your families come and help you out. And when we would do these exercises, we would have all age ranges. Like I think the youngest participants that we had, they were like 15, 16, and like oldest were maybe like 80, 82, I think. And then all different types of health conditions. One important thing that we always try to include in our exercises is modification, because we want to avoid injury. So for most of these, there is a modification. If there isn't, if I didn't include one, I can talk about it at the end. And I think that's something to think about whenever you're looking at any exercise program you want to do or any exercise you want to start doing, whether you see it on YouTube or anywhere else. Like stop and think like, okay, is there modification I can do? Because sometimes, you don't know what the tolerance is going to be, or maybe like you have a pain in a knee or something, but always think about modifications that you can do. Para esta parte de la presentación voy a hablar de ejercicios que pueden hacer en casa. Estos son ejercicios que hemos enseñado en nuestras clases. Y lo interesante de estos ejercicios es que tenemos muchas modificaciones. Las personas que vienen a nuestra clase, el más joven tiene como 15 años y el más mayor tiene como 82. Y estas son clases que pueden hacer en su casa sin tener equipo o un gimnasio. Y son cosas que también les puede ayudar. So this is a really, fun workout just for, upper body, for chest. We do this a lot with our participants because it's kind of low impact on your joints. If you can do push-ups, we encourage them to do push-ups, but a lot of people in the class have other things going on. So this is like a really good way to build that strength. And then you're really targeting the same muscles you're doing when you're doing a push-up. You can make it more difficult or easier by moving your feet closer or further back to the wall. And then really when we try to do these, we try to think more about, since we're doing it more low intensity, we want to do more repetitions. So we try to go do as many as we can for a minute. And I think I'll send Tara some, I have handouts for all of these in English and Spanish. I'll send them to her. And if you guys want them, you can have those too. So para el primer ejercicio que tengo aquí es algo para trabajar en el pecho. Usa la pared y es como si va a hacer una pechada. Por supuesto, si quieres una pechada regular, lo puede hacer, pero esto es para modificar, para que no tenga tanta presión en las coyunturas. Y también lo puede modificar, lo puede hacer más difícil. Si mueve los pies más para atrás, lo hace un poquito más difícil. Y si pone los pies más cerca de la pared, es un poquito más fácil. Pero lo importante aquí, como no estamos haciendo muchos esfuerzos aquí, queremos hacer más repeticiones, o tratamos de hacer lo más que podamos en un minuto.